Good morning, and I'm very pleased to be here, and thank you, John. So I will start, and those of you who may be checking your emails or websites, by announcing that at this inaugural conference, we did just a few minutes ago post the notice of proposed rulemaking on the co-op rule. So that is now up and out in the public domain. And I can say this because John and I do go way back. He told me that if I show up here today, and we have not posted that rule, that I will regret it. So it wasn't a threat; it was just a statement of fact. And so we did do that, and we're also maybe of equal or even greater interest to you. We will be posting the funding opportunity announcement in the coming days that that travels with the reg, and there's the FOA lays out a number of the loan grant provisions that will be of interest to you. I know on the agenda today there's a couple of familiar names. One is the head of our co-op program. Yes. To get closer? I will try and do that. I can do that. Okay, that's much better. Did you all hear that big announcement? Do I have to repeat that? So on the agenda, I know Barb Smith, who's the head of our co-op program, will provide a much greater level of detail than I will this morning regarding the provisions of the NPRM, the proposed rule, and also the funding opportunity announcement. And I know we also have two members of our FACA here, Alan Fieser and Terry Gardner, and they volunteered so many countless hours as members of the advisory board and helped craft a series of recommendations that led to both the content of the proposed rule and the FOA. So they'll be speaking to you today during this conference, and I think demonstrate the energy behind the creation of co-ops and the unique opportunity that we have to provide new choice to consumers. I was just this past weekend at the NGA meeting and had the opportunity to testify in front of one of the committees on exchanges. So there's been a lot of public discussion around exchanges and other provisions. So it's pleasing, encouraging to see the focus shift to the co-ops and the opportunity that presents, because it dovetails so nicely with the exchanges. It is, what we put out today is a proposed rule. Like all proposed rules, there's a public comment period. In this case, it's 60 days, and although it was the recommendations and the work of the advisory board that so informed the content, we encourage and look forward to getting additional comment on this proposed rule within the next 60 days and making sure that we can keep things on track. In terms of what this means to you and what some of the next steps are, and this will become more apparent as you look at the reg and you look at the FOA, but first is to make sure that you are and will be taking all steps to be eligible for the various loans. And these steps are, again, highlighted in the proposed rule and are going to be detailed later today. Second is certainly to focus on some shorter-term goals, which, again, finding and securing private support, developing a plan to participate in the first open enrollment period. I think we all know how important that is to be positioned and up and running when the fall of 2013 comes around. Developing a feasible business plan that includes statewide operation. All of these are important short-term goals. And then there are longer-term goals, again, associated with the development of the business plan that are consistent with what Don Berwick, our CMS administrator, has been talking about since he got here, and things that are so important to HHS, which relate to delivery system efficiency and reform. So you all should be thinking about how to develop an integrated care model and improve the coordination of care as you think about developing co-ops, thinking about innovative reimbursement models, and embodying in the co-op some of the reform elements of the ACA to improve care and to improve the quality of care and to improve the efficiency of the system and of the co-ops. And thanks to your work now and the work hopefully that you will engage in and the effort that you put into these applications, we will be able to have these co-ops center the market on consumers and provide new cost savings opportunities for small businesses as well. The small businesses, which I'll talk about in a minute, are also such a key focus of the Affordable Care Act and of HHS. Just bigger picture, in 2014, in every state, an individual is just going to be able to log on to their state's Affordable Insurance Exchange website and sign up for coverage. And although that seems like a very straightforward act, it embodies what's at the core of the Affordable Care Act, which is building a health insurance market that creates a consumer control and choice, and it's a consumer-focused and centric experience. Our hope is the co-ops are going to be structured so that they focus on providing value for the premium dollar, which is again another theme that you see throughout the Affordable Care Act, whether it's the MLR provisions or the rate review provisions. And again, as I mentioned, improving the quality of care and the quality of coverage for individuals who are in the system and who are members of the co-ops. Of course, you know one of the reasons why consumers will be empowered under this particular provision of the ACA is not just the underlying protections of the ACA, but when it comes to co-ops in particular, consumers take an active role in the decision of the co-ops. This is, of course, because the board is elected by the members, and the members make up a majority of the board, so the co-op will have a stake in educating consumers about the coverage offered and how that coverage can be improved upon. I mentioned before also that co-ops are going to be free to adopt innovative models, and not only free, but we encourage them to adopt innovative models and arrangements in the care delivery system. And this also will improve health outcomes from the coordinated care and the chronic disease management as well. On the topic of small businesses, again, co-ops are not just necessarily for individuals, but can play a vital role in helping the economic growth in the states. When I was out at the NGA, there was a lot of focus on job creation, as you can imagine, and on innovation. And we know that small employers are, in so many states, in so many areas, the engine of economic development. And they have been particularly strained by the rate of growing healthcare costs over the last decade. One statistic, in the past 10 years, the percentage of small businesses offering health coverage has dropped from 68% to 59%. I think I've seen studies that have even more dramatic changes. Small businesses pay on average about 18% more than large businesses for comparable coverage. They experience higher administrative costs. And by one estimate, if the status quo before the Affordable Care Act continued through the next decade, there could be upwards of 175 or 200,000 jobs lost because of the burden of rising healthcare costs. So the Affordable Care Act has a number of provisions that assist small businesses, and I think co-ops is one. As you know, under the exchange provisions, there is a small business health options plan, the SHOP program, which is the exchanges for small businesses. And our proposed rule provides another line of assistance to small businesses by permitting co-ops to offer their coverage in the small group market. And this, again, helps give small business owners clout in the decisions about health coverage for themselves and their employees. Insurance markets, we know, are local markets, and that's why the ACA leaves a lot of leadership to the development of exchanges in the states, but it's also why the ACA encourages a co-op in each state. And I'm very excited at the regional diversity that I've seen in attendance here today, and I think it signals that there's a lot of support for co-op development in regions across the nation. The focus at the state level and the commitment to state leadership and local markets is very much a part of the culture at HHS. I know you know that the secretary is a former governor, former insurance commissioner that John and I served with, former legislator. I've been in various roles in state government, and we have many of our people at HHS and exchanges and on the co-op side that have worked in state government. So we do have an understanding of the key roles that states play in healthcare and health insurance and reform, and definitely understand the value of strong collaborative relationships between HHS and the states, and I think co-ops will play a very important role in that collaborative process. Some of the examples that I've become aware of that we've got in Tennessee and South Carolina, there's small business coalitions working together to create co-ops to improve choices for small businesses and individuals. Rhode Island, Connecticut, Illinois, where we've got hospital and physician groups working to create co-ops. In Maine, primary care providers working together to create a co-op there to serve the state and emphasize primary care. Maryland, we've got physicians that have managed chronic diseases in their communities creating a co-op, looking to create a co-op that will focus on prevention and care coordination and eventually serve larger parts of the state. Arizona, large multi-specialty groups exploring formation of a co-op. In New Mexico, community organizations working with rural providers. And so we're pleased to see a diverse range of interests and angles and backgrounds and geographic representation, and really look forward to getting into this next phase of operationalizing this program. So in conclusion, this program is just incredibly exciting and offers yet another opportunity to realize the vision of the Affordable Care Act in a very concrete, meaningful way. And I can tell you that we, meaning Barb and Richard Popper and many people back at HHS, have been kind of working tirelessly to make sure that we're hitting our timelines, making sure that we were prepared today, and more importantly, full of incredible energy moving forward. The level of excitement that I get from Barb and Richard and their teams, and anticipation, just kind of ready to sink our teeth into this and get the FOA out and get you all working and getting that ready to come back to us and evaluate is, it's very exciting. So I appreciate everyone coming out today, I guess not knowing what exactly he would be talking about. So there will be more to talk about in addition to whatever else you guys had on your agenda. But I do appreciate the opportunity to come here, and just seeing all of you here is very exciting. And I don't really have much else to say because the details will be left to those who know them.